let's move on. All right, just a review, okay? And before we move on, introduction to the muscular system, right? We talk about the muscular system have 3 types of muscle, right? We have skeletal muscle, cardiac, and smooth. And hopefully by now you know the difference between the 3. And then your muscle is divided into different parts, right? You start out as a muscle, what we know as muscle. But within your muscle, you have these fascicle, right? These compartments that hold multiple muscle fibers or cell together. And within each muscle cell or fiber, you have these filaments called myofibril. And there are 2 types of filament that make up a myofibril. Remember, thick filament and thin filament. Thick filament is myosin, thin filament is actin. And again, fascicle. So let's focus on the point of the fascicle. Let's go over what a fascicle, why it's important to have fascicle, okay? So again, fascicle is when you have multiple muscle cells come together to create this compartment of muscle fascicle. So there's multiple muscle cells or fiber in there. We classify different skeletal muscle by the organization of the fascicle, how they are organized, right? You have all these muscle in your body, right? All these skeletal muscle, okay? I'm not talking about cardiac, I'm not talking about smooth, all the skeletal muscle in your body. And they are organized by how the muscle fiber are organized. There are 4 patterns that make up all these skeletal muscle in your body. You have, and they are determined by how your fascicle are organized. They are either parallel muscle, they are either convergent, pennant, and circular muscle. Okay, let's go over each one of them. Parallel muscle are muscle that they line up parallel like this. The fibers, the fascicle. Fascicle again have multiple muscle cells in there. They compart together into these parallel shape. You see parallel? They tend to be one end, start one end small, and they branch out, and then they all end up in the other end, or we call them tendon, right? Your bicep, for example, bicep brachii. Brachii is the arm, bicep muscle, right? Is considered parallel muscle. Or your tricep as well, all right? And that's parallel muscle. The second type muscle is what we call convergent muscle. Convergent muscle is opposite. They don't have a small end on both sides, right? And big part in the middle, but they start out big and then they converge into a small ends, which we call them tendon. Remember, tendon connect muscle to bone, all right? So convergent muscle would be your pectoralis muscle or your pectoral muscle, your chest muscle. Make sense? And that's different from your parallel muscle. You see, parallel muscle, 2 smaller ends. Convergent, just 1 smaller end. Okay. And the third type of muscle organization is what we call pennant muscle. Pennant muscle look like a feather. Right? Think of feather, right? You can either have uni-pennant, that means only one feather, or you can have bipennant where there's 2, look like 2 different feather put together, okay? And they are not parallel, well, this one kind, but then they have a feather shape, right? And they're not just parallel one direction. They each pennant will have its own pattern, right? They do not move as far as parallel muscle. So they are restricting with their movement. They contain more myofibril than parallel muscle. That means they contain more of these filaments. So that means they develop more tension. That means they are used more for harder workload, right? Heavier workload, because they have more myofibril. So that means they create more force, more tension. Unipennant example will be your extensor digitorum. Digit mean your fingers. The muscle that help you extend, flex, extend, flex. Remember, flex is you reduce the angle, right? Yeah, remember the the key, the root words. Extend means you broaden the angle. So extensor, digitorum, allow your finger to do this. Extend. Digit fingers. Okay. We'll talk more about them. Bipennate would be this muscle that have two different feather shape. Rectus femoris, right? Has to do with your femur, right? The muscle that allow you to control your femur bone. If you guys don't remember, femur is the bone that connects to your pelvic femur. Okay, and then multi-pendant would be they have more than two of these feather-like, and your deltoid would be an example. Okay, and we'll talk about these muscle later on. And the third type of muscle is what we call fourth type is what we call circular muscle. These are muscles that are organized in a circle. An example would be your mouth. It has circular muscle. Right? You move your mouth open in circle. Right? And then there's another part in your body that's also circular muscle. And I'll leave it to you to look it up. And these muscles are what we call sphincter, right? Because they're circular. They contract, close, open to allow thing go out, close, or thing go in, right? So, and that's the four types. So everybody, can you guys respond to this question for me? Which fascial organization make up your pectoralis muscle? Choose pectoralis muscle. We mentioned that earlier. Let's check to see if you pay attention. Which muscle organization? Is it parallel? That means two ends are small, larger middle part. Pennant means they look like a feather shape. And it's your convergent muscle. Okay, moving on. All right, so that's how muscle are organized. Let's talk about how muscle create movement. And for muscle movement, we call them lever, right? Like a lever. A lever is like a seesaw at the playground that you see, right? You have two ends, and there's something in the middle that allow it to move up and down, right? Like seesaw at the playground, like this, right? So we call a lever. Skeletal motion, skeletal muscle attached to the skeleton. That's why it's called skeletal muscle. It produces a motion. Type of muscle attachment affects the power, the range, the speed of the muscle movement. Right? Or we call that lever. Lever is how each bone is connected to the muscle, or the muscle connected to the bone to create a movement. And how they are connected can determine the strength of the movement. Okay, so it's kind of like in the lever, you have what we call a fulcrum. A fulcrum is like a middle point. And then you have an applied force and you have a load. It's like a lever, right? To balance out. So in your muscle, a fulcrum would be a fixed point, like a joint, right? A fixed point. I mean, this point, they don't move. It's like a lever. In the middle, they don't move. But what move are your load and apply force? Muscle provide apply force, right? Because your muscle goal is to contract, to create a force. And the load would be what you're trying to move. So for example, if I'm doing squat, for example, right? You work out, right? The muscle that are moving the weight on my shoulder, right? Are what we call applied force, because that's the muscle they're gonna create a force. And the load that they try to move would be the weight on my shoulder. Make sense? And then the point that stays still will be the fulcrum. So there are three types of lever, three classifications. There's first class lever, second class, and third class lever. Let's talk about how the three types different. Okay. The first class lever is this simple seesaw motion. That means the fulcrum is in the middle. Apply force is at the end and the load is the end. So for example, this person right here need to correct his neck, right? Move his neck up, moves his head up, right? The fulcrum would be this bone right here, the temporal bone right here, right? Apply force will be this muscle right here. It will create a force. It will contract, and we will allow him to move this low up or his head up. Right? First class lever, symbol, fulcrum in the middle, apply force are two equal distant at the end. Right? They are balanced. And then you have the second class lever. Second class lever, if you look at the difference, is that the fulcrum is at the end now. It's not in the middle. Okay? And the apply force is at one end and the low is in the middle. This second class lever is a little better. It allows small force to move a large weight. For example, you have your muscle here, right? It apply force, it contract, and when it contract, it's able to move the load, your whole entire body, right? Have you noticed how amazing it is that you just have to tiptoe up and your entire whole body is being supported by this muscle that contract to pull up your entire body. And this is what we call second class lever. So it allows you to apply a small force, but to move a large weight, okay? And the difference is that the fulcrum is the end, right? And then the third type is what we call third class lever. This is the most common lever in our body. The center, the fulcrum again, is at the end, but the applied force is near the fulcrum, and the low is at the end, the other end. All right. This will provide you the greater force to move smaller load. So that means this is the thigh muscle that you just have to put less force, but it can move a lot more. Oh, my bad. The opposite, right? Greater force to move smaller load. Okay. So that means you gotta put in a lot of force just to move a tiny motion or a load. Unlike the second class lever where you use small force to move large load. So the opposite, okay? First class is the same. The applied force and the load equally the same force. Make sense? So that's the difference between the three of them. Third class, you gotta put in a lot of load, a lot of applied force just to move a tiny motion. Which in turn, it maximizes the speed, okay? Because you're able to contract fast, right? So because the load is so small, but you're able to move things fast. All right, so that's the opposite, the difference between the first, second, and third. So make sure you get a chance to review. Look at the fulcrum and how the applied force and load are different from each other, okay? All right, let's talk about how muscle are attached. Okay, so today we kind of give a summary of a general organization or classification of how different skeletal muscle are create force and also attach. So muscle attachment. So this is the third topic, muscle attachment. We know that our muscle can only contract and relax. It does not push, pull, grab, run, right? Jump. It does not create those movements. Those movements is created when you have multiple muscle work together. It's kind of like in the video, the guy pulling the iron door, right? Just one muscle, just a few muscle does not work. So he has to use the muscle from the entire body, all right? So that means muscle work together to create movement. Okay. Smaller muscle reach maximum tension first, followed by larger primary muscle. It makes sense, right? Because they're small, so they create the tension. They reach the maximum tension first, and then the bigger muscle will add in more tension. Some terminology for you to think of, to remember. You have agonist muscle. This is like the prime mover. This is a guy that the muscle that will put in the most applied force. And then you have the antagonist muscle, the muscle that is the opposite end. If this guy contract, this guy will do the opposite motion, which is relax. Make sense? And then you have synergist muscle, or the smaller muscle within this action that put in other force to assist the agonist, right? So you have the agonist, the antagonist, and synergist. For example, if I need to flex, right? If I need to flex, my agonist, my primary muscle that will be contracting to create this apply force will be my bicep. On the other hand, my opposite muscle has to relax for me to be able to flex, right? You ever feel it? If your bicep contract, your tricep in the back here will relax. You can feel it. It's not as tense, right? So agonist, antagonist, and then you have other like brachia, radialis, like smaller muscle in the forearm that kind of work together to help you flex as well, right? Smaller muscle called synergist. So those are the three terms. Make sure you review them as well. Okay. Muscle opposition, we said it right. Agonist, antagonist work in pair. One contract, the other one have to stretch, right? To create flexor, extensor, abductor, adductor, right? Different motion that we talk about. Flex, extend, right? Abduct, right? Abduct, right? Adduct. Right? Adduct is toward the body, right? Toward the middle. Add, like adding the angle toward the middle. Okay, let's see. And agonist is bicep, antagonist is tricep. You're correct. Okay, let's move on. So we have enough time. All right. We're gonna end this note with naming skeletal muscle. Right, there are different ways of naming your muscle. I'm just gonna go over quick. We will get a chance to look more in depth of different muscle next week. So because there's a lot of way of naming muscle, but you name your muscle by there's different how you describe them, right? It could be location in the body, like where they located. For example, bicep brachialis, right? Like it's in the brachii, which is your arm, right? And then you can also name by the origin and insertion, where they start and where do they connect it to. You can name them by the fascial organization we told you, like parallel, convergent, circular. You can name them by relative position, just where they are closest to, like are they closer to the pelvic, closer to the shoulder girdle, right? Structural characteristic and action as well, how they move. I'm just gonna go over quick, okay? Fascial organization, right? We know that, like you can name them based on how the muscle fibers, cell, are structured, right? You can name them by position, externus, for example, like outside, internus, inside, extrinsic, within, intrinsic, I mean within, toward muscle outside an organ, muscle inside an organ, and so on. So there's different way. I'm not gonna spend that much time on it because again, it's a lot. Right? You can name them by the number of tendon they have. By the tendon means the end that connect to the bone. They might have one end that connect to the bone or two end. By shape, like trapezius, deltoid, rhomboid. By size, how big they are. By movement, right? Flexor, extensor, retractor, and so on. All right. So, for example, they can also name them by region of the body. Abdominis has to do with the abdomen, right? Ankylosing has to do with elbow. Brachialis has to do with the arms. Capitis has to be the head. Carpi has to do with wrist, right? And so on, right? So there's multiple ways. Do I expect you guys to remember all of them? No. But just know the general that you can name them by location. You can name them by shape. You can name them by how they're fascial organized, right? Region, there's a lot of muscle within region. For example, tibialis muscle has to do with the tibia, right? Tibia, fibula, if you remember. Ulnaris has to do with the ulna, radius, and so on, right? There's more, okay? Then you can also name them by the nature origin, like where do they start, or like at what point which bone do they connect to, and then which bone do they insert into as well. by shape. Talk about that, right? And then other characteristic, you know, like what color, are they short, are they slender? So there's multiple names, and I don't expect you guys to remember them. All right, last question of the day is draw a pendant muscle. We talk about how muscle fascicle are organized. Draw a pendant muscle. What you guys draw? Can't wait to see. Oh, okay, pendant muscle. Yeah, you're right. This is uni-pendant, right? Only one side, like a feather. Just think of it as feather. Oh, my bad. Let's see more. Okay, yeah, okay. So it definitely have striation, right? Lines, okay. And of course, the white part tend to be what we call the tendon, right? That's where it connected to. So this is uni-pendant, right? I guess nobody draw the bipendant, like your bipendant. Ah, there you go. Somebody drew a bipendant, right? So there's two different feather come together. So that's a pendant muscle, pendant. Remember, be careful with the striation. Usually they go from the insertion to the attachment, right? Insert to attachment. That's usually when you draw muscle, you draw striation. By the way, we will be drawing muscle, okay? So keep that in mind. We're not, so remember, be careful. No, when you draw muscle, skeletal muscle especially, pay close attention to the striation, right? They don't striate like that all the time, right? If there's only one, then they tend to go from the attachment, right, from the origin to the attachment, which is the tendon attached. But it's a good start. Okay, all right, yeah. Okay, so I'm gonna leave that there. So hopefully you guys continue practice and read your note again. It's a lot of information. Read your note summary, but we will be learning more about muscle. All right. Like different muscle in your body, just to familiarize yourself with them, right? Besides having to know how they contract and so on. So I'm gonna stop recording there.